Hello, my name is Adriana Ruiz Velasquez. I'm part of the RN to BSM program at SB College, and today I'll be presenting the pathophysiology of diverticulitis. Diverticulitis is the inflammation or infection of the small pouches, also known as the diverticula, that form in the wall of the colon. By the end of the presentation, the definition of diverticulitis will be described and its underlying pathophysiology. Identifying the most common risk factors and the disease manifestations, signs, and symptoms on a clinical case. The treatment option will also be discussed along with the nursing intervention that are essential to take care of patients with this disease. These objectives will guide the presentation and ensure all the information above is well explained and covered. Diverticulitis has a significant impact on the U.S. population and the healthcare system. Approximately 200,000 people are hospitalized due to diverticulitis each year, making this the most common cause of lower GI admissions into the hospital. The risk increases with age, particularly after the age of 40. Diverticulosis also places a considerable burden on the healthcare system with associated costs tied to frequent ER visits and hospitalizations, as along with treatment and complication. These statistics highlight the need of prevention and education with timely interventions in patients. Diverticulitis occurs when diverticula in the colon wall become inflamed or infected. Age is one of the strongest risk factors as the colon wall weakness over time. Especially after the age of 40, you become a higher risk of developing diverticulitis. Also, a low fiber diet and chronic constipation increases colonic pressure, which promotes the formation of the diverticula. Finally, certain medications, including NSAID, corticosteroids, and opioids, have been linked with diverticulitis. Recognizing these factors is key prevention and patient teaching as well. The pathophysiology. Diverticulitis begins when diverticula, which are the small pouches that forms in weak areas of the colon wall, become obstructed. This blockage, often caused by stool or undigested food, allows the bacteria to multiply within the pouch, leading to inflammation and infection. The resulting inflammatory response can cause pain, swelling, and systemic symptoms like fever. If untreated, diverticulitis can progress into perforation or even peritonitis, leading to sepsis and multiple organ failure, which can be life-threatening. The most common symptoms of diverticulitis is abdominal pain, typically presented in the lower left quadrant. Patients may also experience fever, nausea, vomiting, and changes in bowel habits, such as constipation or diarrhea. While many cases are mild, diverticulitis can lead to serious complications. These include the development of abscess, perforation on the colon wall, and peritonitis, which is the life-threatening infection. In severe or recurrent cases, patients may develop sepsis or require surgical interventions. Recognizing these manifestations early is critical to prevent the progression and complications. The treatment of diverticulitis depends on the severity of the episode. Mild cases are often managed with oral antibiotics and a temporary liquid diet with rest. For moderate to severe cases, patients typically require hospitalizations, IV antibiotics, and close monitoring. In complicated or recurring cases, surgical interventions such as abscess drainage or partial bowel resections may be necessary. Prevention strategies are vital. These include following a high fiber diet, maintaining adequate hydration, and engaging in regular physical activity. These approaches help to reduce the risk of recurrence and complications. From a nursing perspective, evidence-based practice plays a central role in managing diverticulitis. Nurses are responsible for monitoring vital signs, bowel function, and assessing signs of perforation or sepsis. Supported care includes pain management, IV fluids, and ensuring proper antibiotic therapy. Education is key. Nurses should emphasize high fiber diet, proper hydration, and regular physical activity to reduce recurrence. Importantly, research has shown that food such as seeds and nuts, once thought to be harmful, are not longer considered contraindicated, reflecting a change in practice supported by current evidence. This highlights the importance of keeping nursing care aligned with evolving evidence-based guidelines. With this, we conclude these presentations. Here are all the references attached to all the slides, and thank you for your time.